Hey, welcome to The Explainer. This is where we take big, complex topics and, well, we explain them by going straight to the source material.
All right, let's just jump right in with a really big question. Think about this for a second. What single thing doubled human life expectancy in the 20th century? Doubled it. Was it, some kind of miracle drug, a massive surgical breakthrough? The answer, well, it's probably not what you're thinking.
So to get to that answer, we actually have to go back in time. Back to a world that was absolutely gripped by this terrifying, deadly mystery.
Okay, picture this. We're in London. The year is 1854. Specifically, the Soho district. It's crowded, it's bustling with life, but it's also a place with, let's just say, terrible sanitation. A place where life could be incredibly short and dangerous.
And right then, a horrifying disease is just tearing through the city. We're talking about cholera. It's incredibly fast, it's brutal, and the worst part, nobody has a clue how it's spreading.
So what did they think was causing it? Well, the best guess, the leading scientific theory at the time, was something called miasma theory. Basically, the idea the disease was spread by bad air, foul smells coming from garbage and waste. It kind of makes sense, right? Smells bad? Must be bad for you. But that theory, it was dead wrong, and dangerously so.
But here's the thing. This terrible crisis, it's the very thing that sets the stage for an absolutely monumental breakthrough in how we think about health.
And that breakthrough leads us to this idea, public health. Now, this is the textbook definition, but what does it really mean? It's not about treating you or me when we're sick. No, it's about protecting the entire community, the whole population, and trying to stop us from getting sick in the first place.
So, enter our hero, a physician named John Snow, and he does something revolutionary. He starts mapping the deaths. Like a detective, he puts every single one of the 616 cholera deaths on a map of Soho. And what does he find? A shocking pattern. They're all clustered around one specific water pump on Broad Street. He goes to the local officials and says, "You have to remove the handle from that pump." They were skeptical, but they did it. And guess what? The new cases just stopped, almost overnight. The killer wasn't in the air, it was in the water.
And this really gets to the heart of the matter. This is the key difference. You have clinical medicine. That's your doctor, right? They focus on you as an individual, usually when you're already sick. But public health, it focuses on everyone, the whole population. The goal is to prevent the illness from ever even starting. I love this analogy. It's the difference between constantly pulling drowning people out of a river and going upstream to figure out why they're falling in to begin with.
All right, so with this brand new way of thinking, this focus on prevention, humanity started to rack up some of its biggest wins ever.
So this idea of organized prevention just explodes over the next couple of centuries. You have Edward Jenner developing the smallpox vaccine way back in 1796, then fast forward to 1955, and Jonas Salk's polio vaccine gets rolled out after this enormous trial with 1.8 million kids. And it all leads to this incredible moment in 1980 when the World Health Organization announces that smallpox, an ancient killer, has been completely wiped off the face of the earth, gone.
So remember that question we started with? This is the answer. In the 20th century alone, life expectancy in the US shot up by almost 30 years. And while, new medicines and treatments helped, the lion's share of that incredible gain, it came from public health. Things like clean water, better sanitation, and, of course, vaccines.
And here's something you might not think about. These interventions aren't just saving lives. They're also unbelievably good investments. Look at this. Wiping out smallpox cost about $300 million, but it saves the world over $1 billion every year. And childhood vaccines in the US, for every dollar spent, you get $52 back in benefits. It's just staggering. Prevention, it turns out, is a massive bargain.
Okay, but here's where things get tricky, because having the power to protect an entire community, well, it brings up some really tough ethical questions.
This quote right here is from a Supreme Court case way back in 1905. It was about a smallpox vaccine mandate, and it lays out the fundamental conflict that is still at the heart of public health today. The individual versus the group. Where do you draw the line? When should my personal freedom be limited for the safety of everyone else?
And that core tension, that balancing act, really defines all the biggest challenges and, frankly, the messy reality of public health in the modern world.
So on the one hand, you have these amazing modern triumphs. Just look at youth smoking.
Through decades of public education campaigns and new policies, the smoking rate for young people in the U.S. just cratered. It went from 28% in the year 2000 to under 5% by 2022. I mean, that is a huge, undeniable win for public health.
But on the other hand, that same power to guide the health of millions comes with a massive responsibility. And sometimes, even with the absolute best intentions, that guidance can backfire. A classic example is the low-fat craze that started in the 1970s. The advice was to cut fat. So what did the food industry do? They took out the fat and pumped their products full of sugar and refined carbs to make them taste good. And now, many sources point to that very shift as a major contributor to our modern obesity epidemic.
And look, this challenge of making huge decisions for everyone, often with incomplete data, was put to the ultimate test during the COVID-19 pandemic. And when we look back, source analysis point to some really significant shortcomings. Things like lockdowns that came with massive economic and social costs, but maybe had a limited effect on mortality. Or prolonged school closures that led to very real learning loss and mental health issues. And then there were the vaccine mandates, which often didn't account for the strong protection that people got from having had the virus already.
Now, despite all these controversies, and they are real and they are important to talk about, we can't lose sight of one thing. The best public health is the public health you never even notice. It's the fact that you can turn on your tap and drink the water without a second thought. It's the food safety rules that mean you don't get sick from your dinner. It's the sanitation systems working quietly under our feet. It truly is an unseen guardian, protecting us every single day.
And so all of this leaves us with what is maybe the central question for our time. It's a question that the people back in Jon Snow's day could never have dreamed of, and it's one with no easy answers. Looking forward, how do all of us, balance the need to keep everyone safe with the fundamental right to individual freedom? Finding that balance, that's the great challenge of our century.